When life gets unpredictable, preparation matters. In medicine, it's all about staying alert, ready for whatever comes through the door. On the road, it's no different. That's why Volvo designs vehicles to help anticipate risk, reduce harm, and protect lives. The Volvo XC90's advanced safety systems inspire confident decisions wherever the road takes you. The Volvo XC90, for life. Proud sponsor of the Pit Podcast. Learn more at volvocars.ca/safety.
Our next guest volunteered as an orderly, wrote a 3-day diary about the experience that was published in the Globe and Mail. It's our pleasure to have Terrie Laplante-Beauchamp join us now. Hi, Terrie.
Hi.
You are a master's student at Université de Montréal, correct?
Yes, exactly.
So why don't you just tell me a bit about what you're studying and your previous experience that allowed you to even put yourself up as someone that could volunteer to help out in this situation?
Well, about 10 years ago, I got my diploma as an orderly, and I started working as an orderly back then, and I didn't quite like it because with the health system we have, giving the patients the help and support that they deserve wasn't really possible, and I found it really difficult to deal with.
And this is 10 years ago, Terrie, right? That
was 10 years ago, exactly, when I got my diploma. I changed my career path, and now I completed a bachelor's degree in immunology, and I'm doing my master's in the same program right now.
So you change your career path, and the pandemic hits. And you see how much pressure the system is under, and you say to yourself, okay, I want to help. Tell me about that process of actually getting back into the system and volunteering.
Well, a few months ago, I had to quit my master's lab, and I was trying to find another one. But because of the pandemic, it's just not possible because everybody's super busy. Everything is closed. I was stuck at home by myself. I felt completely useless. I really wanted to help during the crisis, and I have this diploma, so I figured I'd apply directly to the West Island CISSS, and I got hired on the same day that I applied as an orderly.
And where did they place you?
They placed me in the La Salle Center.
And when you got there, what did you see?
Well, it was really hard, I'll be honest. It's my first pandemic, as many other people. I could tell that there were some major issues, and I was really surprised that they hadn't been taken care of when they had already been in lockdown for almost a month. There was some the major issues that they had was the total absence of directives whatsoever. I was sent directly to the COVID unit by the supervisor straight away.
This is your first day, and you know, I read your whole diary on the Globe and Mail website, Terrie, and I want to, so everyone gets this. You volunteered, you get placed right away. They send you to La Salle. You show up your first shift at 3:30 in the afternoon, and no training, no orientation, and you get sent to the COVID-19 positive section.
Exactly, and I wasn't the only one. We were a bunch of new people, and even the days after, a lot of new employees, a lot of new staff, fresh out of school or still in school, and people who hadn't been orderly for years, or things like that.
We're with Terrie Laplante-Beauchamp. She's a Université de Montréal master's student. And at the beginning of April, she took it upon herself to volunteer as an orderly. Terrie, let's talk about the stories about people, and what you saw over your 3 days.
Well, the thing that was the most heartbreaking for me was hearing patients tell me on a daily basis, multiple times per day actually, that they really, really wanted to die. And now, like in elderly centers, you often hear about elderly people wanting to die, especially those who don't have much family or that are in pain. It's not something new, but this time it was different because a lot of them, they wanted to die because they were confined to their rooms and they were losing their autonomy way faster and losing their will to live at the same time. So it was absolutely heartbreaking.
Anything shock you? I mean, hearing people say that they want to die, but you mentioned, you went into reasons why that happens in some certain situations. But was there anything that was shocking as to the care that you saw?
Well, negligence, a lot of negligence for sure, because we don't have time to do the basics really. So some people hadn't eaten completely their meals, or they were the hygiene wasn't up to the standards, and it was really hard to see. So some people were telling me that it had been like a week or 2 weeks that their beds hadn't been changed. It was negligence overall.
You said you were placed immediately at the COVID-19 positive floor in LaSalle. Mm-hmm. So did you have the right protective equipment?
Well, sometimes yes, sometimes no. I would actually have to run after the equipment, like to get some, to ask constantly the supervisor, because we were missing some gowns or the masks. Also, on my first day, I asked for an N95. They said that they couldn't give one to me. And although I do understand for nurses that they don't really need it, for elderlies, when you're really, really close to the patient and you're trying to help them sit down or something like that, when they cough, the surgical mask is not enough to protect yourself.
Yeah. Your third day, you start your second double shift.
Yeah.
And you write about this story about a family trying to celebrate a birthday. Tell us about that.
Yeah, well, one of my patients, it was her birthday, and we're on the first floor, so luckily some families, they can come to the window and just like say hi to the patient. But this patient, her daughter was there with a huge sign saying happy birthday and all, and I found it really, really sweet of her. And they were on the phone talking, and it was just hard to see really, because the patient cannot be fully turned towards the window, so she couldn't really see the sign, but she knew it was there. But still, it was hard.
You got a fever and you had to stop, correct?
Yep.
So did you get tested for COVID-19? What happened there?
Well, actually, I had a vasovagal shock on the 10th during my shift. I was transported by ambulance to the hospital, and since I had a bit of fever at the same time, they tested me. Mm-hmm. They unfortunately lost my test, but they still told me to stay in quarantine, and they retook it. And then they called me back and said that I was positive. I started having some symptoms on the first day that they called me.
Wow.
I had some fever, dizziness, and I was hospitalized 2 days later for shortness of breath.
No training. 3 days in there, you get COVID-19.
Well, more than 3 days, but a week, let's say.
Yeah. Terrie, are you recovered?
Well, yeah, I'm fine now.
Okay.
Thankfully, yeah.
Would you go back?
Well, actually, I'm thinking about it, yes, because, I could only help for a week or so, and in the end, I really wanted to do more. I was supposed to do like 240 hours in a month. And I really want to continue helping.
Well, Terrie, I wish you the best. And I thank you so much for coming on the show.
You're welcome. Thank you so much.
On the Globe and Mail website, if you want to read Terrie's diary, it's called 3 Days of Death and Disorder, a Montreal orderly's diary from a nursing home's coronavirus outbreak. Terrie Laplante-Beauchamp, thank you so much for joining us.